Hey guys, it's Dr. Brandie from another episode of Pregnancy Pain Sucks. I have a great guest with me today, and I just pulled her. We were talking and having a great chat, and I want to introduce you because I was having the most amazing talk. And even though we do different things within the pregnancy and motherhood realm, I was like, you guys have to hear her. So I'll turn it over to you to introduce yourself. We were joking that both of us, since we just got pulled onto this call, our offices are both messes and I've got dogs running around everywhere. But welcome, Shruti. Please introduce yourself and tell my audience what your passion is, or you just tell me that really touched my heart.
Absolutely. Thank you so much, Dr. Brandie. It's been an honor joining you here today. Um, I am Shruti. I am a transformation coach. I support women and busy professionals who have been knocked down by pregnancy loss or burnout or any other life's big challenges. I help them upgrade themselves. I think we upgrade our devices, but we forget to upgrade our own selves. So in IT terms, I have a background in IT as well. So in IT terms, I say upgrade yourself from version 1.0 to 2.0 and keep on upgrading yourself.
That's great. Yeah, I use
Um,
chapters. Like there's chapters of a book. So I'm on chapter 3 right now. But you were telling me something like we were just talking. We got real intimate, real close, real quick. And I love relationships like that. And she had so much to say. So Shruti's has a lot of background of loss. And we were talking about the stigma within pregnancy that you can't talk about it, or that you're told to normalize it, kind of like I'm with pain. Yours is a different kind of pain. So talk to me about that with the pain of losing. I've never lost a child, either pregnant or thank gosh, but at the same time, tell me because I have a lot of patients who have experienced this and it's not sometimes okay to talk about. Like it's not, or people say really crazy things that are very hurtful. So talk to me about what you were talking about that was so touching.
Absolutely. So I am blessed with three beautiful kids. However, I've also lost three babies. And for me, it took more than 11 years to even seek help and address it through therapy. My first loss was at 9 weeks. The baby never developed a heartbeat, and I was given a pill. It was December of 2011, 31st, 2011. We were actually going to announce that we are pregnant. And that same morning, I was told there's no heartbeat, you have to terminate. And I was sent back home, and that's how what I did on that day. And still remembering, um, sorry, one,
I can imagine.
remembering that um, went into labor. I had to pass that red blob and flush that toilet. And the worst thing was my 2-year-old daughter watching me scream in pain, not understanding what's happening to mama. And what did I do? I started looking for jobs and started working. I didn't know how to brief for something and I was got to hold. I didn't know. And the society also tells you to just move on because I was 27 at that time. So I was like, oh, you're young. You can get pregnant again. You already have one child. So you kind of validate that and just move on in what terms, I don't know, but that's what I did at that time and felt that it will go away. The pain will go away automatically. A few years, I was fortunate that I got pregnant and my middle daughter was born. A few years later, I was expecting identical twin boys and I lost them at 23 weeks. Um, it was again for me, I held them all night. I delivered them on my daughter's seventh birthday, which was again very chilling for me that it, she was planning to celebrate her birthday and I went into labor and I delivered my babies because of complications. It for me again, I went back to work within a week. I didn't know what to do, whether I should seek any help. While getting discharged, the doctor and the nurses handed me a packet of resources, but I just came back home and threw them away. I thought, I don't need any support and I'm fine. And yet again, the society tells you that, you already have two kids. So, it's okay. Just be the brave mom, the strong mom, and do not cry in front of kids. It's very bad for them. So I did that. The following year in 2018, I was blessed again to have my baby boy. But 2019, 2020, even amidst the pandemic, 2021, I was getting panic attacks. Every now and then, I would rush to the bathroom in between meetings, have a breakdown, and not understand why it's happening to me. And then I'm cursing myself, like, Shruti, you are so stupid. Like, you cannot live happily. You give yourself the worst comments possible. Like, you can't be happy. You have a happy life. You have three beautiful children. You have a job. You have a house. You have a wonderful family. But you still want to whine about the things that you don't have. And I didn't even know what it was.
Mm-hmm.
I was telling myself. It was only in 2022, my company was offering complimentary therapy sessions. And then I just said, okay, you know what? Let me give it a try. I don't know what I'm going for. Therapy, anyways, I don't want to talk to anybody.
No.
I didn't even tell my mother when I was going for therapy. I just booked a call. I actually hung up on them twice before making the final call that, okay, I think I need help. I don't know. And I thought the therapist was going to be like, the same thing. Like, you have everything. You just want to create problems in life. On the contrary, the therapist was shocked to hear that I ignored it for so long and was keeping within myself. And that's when my transformation began. I experienced a life without therapy versus with therapy. And it changed me to a point where I'm actually able to talk to you about it and be vulnerable if I have to be. And I think that's the most important lesson I learned through therapy. The transformation I can explain you. I remember one of the therapy exercises that I did. I took out a red marker and I wrote, I killed my baby. From that to writing, I did everything to protect my baby. Sorry.
So isn't it? It's crazy how we blame ourselves
Yeah.
because even though it takes two people to get pregnant, we're the ones we feel so utterly. I've talked about that before because my youngest has autism, and I was so stressed. And you feel like if you can't be perfect, then your baby, anything that's wrong with your baby is just completely. You carry that, and people can tell you all day long. And we were talking about how even getting help is so stigmatized. We're embarrassed to say we're in therapy. It's usually the people that you don't expect should be going to therapy are the ones who need it the most. And it's just it's not for the weak. A lot of times it's cultural too. A lot of people in different cultures they don't think. But even I'm from America. My parents don't think that therapy is for people that either have mental health problems or they're weak. And I know that's not what, if you would ask them, that's not what they think, but that's the messaging that you get, that like, that you really can't handle this your own, because I think a lot of people think your friends should be able to handle this stuff, or you should be able to, you can read a book, and you never, same with being pregnant and having a problem, you never know it or understand it until you go through it yourself. And now you're so passionate about helping other women navigate this because it's so awkward. You know what I'm saying? Of what to say the right thing, to what was something that somebody did right? Can you tell me anything of anybody in the two horrible situations you had that did it right? Like, was your partner supportive, or was there a doctor that was really supportive, or this therapist of really helping you understand that this is heavy stuff? Is there somebody that did it right that you could give advice on how to do it right if somebody goes through a horrible situation? If it's like somebody like me who has not gone through that, I can be sad about it, but until you go through it, you don't really understand, and you wouldn't assume that I would understand. I don't understand your pain. So tell me about, sorry, my dog. Tell me about what could somebody do right to really support somebody that just lost their baby, or what is the right thing to say to really support a woman so she can start to heal or understand the gravity of what she just went through.
Absolutely. I think the person who is grieving, so there are two parts to it, right? The person who is grieving, I think the person needs to first, as a mother, mother needs to first accept herself that there is something that I need help with, and then, then try to identify ways to seek help. For the other people, right, who say these things unintentionally, but they are hurtful, you know, we don't need a big speech, especially right after discharge. Like things like time will heal or move on. They were never meant to be. As simple as, I'm here to checking in on you. I'm here to support you. I can talk anytime. As simple as a WhatsApp message or just sitting. I had friends who came to my room where I was in my bedroom after I got discharged. They sat for an hour, spoke nothing, and left.
Just like
That was
sitting there with you and just holding
that
space.
all. I didn't speak a word.
Hmm.
She didn't speak a word. She just sat there and she left. That was enough for me.
Hmm.
I didn't need it. And there were friends who came and spoke so much, and I just wanted them to get out. And they were friends who really care about me. So they are loving people. I still love them too.
Yeah.
They, but it's not what I wanted at that time.
Yeah, I think a
So
lot of people they do that where they do too much, or like it's you don't have to fill the space. Like I think it's exhausting. I talk a lot about batteries. People have batteries, and I think
yeah.
in that moment to make decisions like I want to help. What can I get you for dinner? Like what can I bring over for dinner, or what can I do for you? It's much better just to do something. Try anything, even if it's messy, just to show you care. Just say, I don't do this right. And I might not be saying the right thing, but I really love you and I care about you and I really want to be here for you. And I'm here for you whatever you need. I think that's really what I've said to patients where you're just in a horrible, you don't know what to say. Even if you don't understand their pain, you understand that they went through something really bad. What advice would you give somebody that just lost their baby? And what would you say to her if you could go back and talk to yourself of like what's going through their mind that might be helpful for them to get help or to um, understand better? Because no one goes through this or no one tells you how to deal with
Mhm.
this, right? What's your
Yeah.
best advice?
I I mean, if I were the example, I would just tell myself and others, just listen to yourself and be vulnerable if you have to. The society says don't be. I know it's difficult, but that's the my life mission now, that I want to talk openly about it because it's highly unspoken about. You're allowed to be vulnerable. You're allowed to cry if you have to. You're allowed to cry in front of children if you have to. They need to learn those emotions too. Because when my daughters grow up and if they don't see me crying and see me as this super mom, I'm inculcating the values in them that when they become mothers, they cannot cry. So they should see that I'm a human first and then a mother. So it's okay to cry. It's okay to be vulnerable. And if you feel the need to take help, just go and take the help and you know talk to people who really are there for you really, and stay away from such people who who are saying, who judge you and saying the things that you really don't like in that moment, at least for time being. Even they might be loving people, but you just want to attract all the positivity that you can in those moments.
I think so much of what you said is beautiful. That's why I pulled you on my I literally pulled you off the phone call into my podcast because I think being vulnerable, you're clearly passionate about what you do, and I love seeing that. I love seeing like they say, if you're on fire, everybody will come watch you burn. I'm batshit passionate about giving women a better pregnancy, and I think what you said about vulnerability, if I could say one thing, because this is the year of the snake of shedding, right? Is
Mhm.
is be yourself. And those who care about you and want to be around you will stay around you and understand. And it would also, from me sharing, I shared so much vulnerable stuff recently. It opens the door that other people can be vulnerable too. You give them almost permission to be vulnerable. This fake bullshit stuff we all do where we're all fine. We're not fine sometimes. And just surrounding yourself with safe people. And I really enjoyed meeting you today, like profoundly. you've touched my soul and we just met, but I would love to help you in any way I can, and I love to give you a platform. If anybody has any questions, where can they reach you, Shruti?
So I am on most of the social media platforms. I'm on LinkedIn, TikTok, Instagram, and I create content to just, reach my message. And I also host webinars. So I can share all the information with you, how people can reach out to me. And if people feel stuck in any way, or need that buddy who wants to normalize the feelings, I can definitely support that, and they can book time with me. And the first call is always complimentary to just talk. So happy to share those details with you. So if anyone wants, they can reach out to me and let's
This
chat
is
and
great.
let's normalize mental health. That's my
Yes,
life.
normalize mental health, normalize asking for help, normalize not just accepting pain. I think that's what you and I have so much in common, but in different. Like I've never had a guest talk about this, and even I've been told to stay away from this topic, and we need to talk about this stuff. We need to be vulnerable. I can't think of a better person than you to talk about this. So thank you for spending time with me today. And as I said, my office is a mess, but we need to normalize messes. Our life being messy, just be freaking real. So thank you so much, Shruti. I'll put the information for you guys. But this is Dr. Brandie with another episode of Pregnancy Pain Sucks and How to Make It Better. Thank you, Shruti, so much for being my guest today.
Thank you so much, Dr. Brandie. It was a pleasure talking to you.
Thank you.